Okay, so I think we can get started. For everyone who's joining us, thank you for joining us this morning. If you have any questions through the webinar, please use the chat function and you can write down any questions there and we'll address them as we get to it. And I'd like to take this time to thank Alexandra Mara for joining us. She is the international trainer for Diego dalla Palma. So she trains all the distributor countries and within Italy as well. All the professional training is done through Alexandra. And we're so lucky to have her to join us with her expertise for this long-awaited seminar on the soothing line. So thank you very much for joining us.
It's my pleasure. Thank you so much for having me. I was looking forward to this meeting, even if it's online, but hopefully we'll see each other soon, also face to face, but more on that later.
Yes.
And yes, today we're going to have a very interesting topic, a topic that, let's say, till not many years ago was a little bit more unapproachable for the aesthetical, classical aesthetical field. So we are very happy to grow and develop in this direction. And I hope, and I'm sure that the information that I'm going to share with you today are going to be very interesting. Also because it's, let's say, it's a situation that we encounter more often and more in our beauty salons, beauty institutes. Myself, I have this type of patients all the time. So I think it's quite interesting to learn more about it. So again, thank you to Intercosmetics for having me. And I'm always at your disposal for any questions and anything that I can help you with. Okay, so let's get started because we have a lot of things to go through. We have had this very important launch in our assortment, the relaunch of the Soothing line. Soothing line that is very important to us. And that obviously, as the name says it, is dedicated for all sensitive skin. We have reformulated this range. We have completely rethought the whole concept. And of course, the sensitive skin treatments are one of the most important ones that we have in our beauty salons. They are our, let's call them SOS treatments. So we always have them there to use whenever something is going on. The numbers worldwide are quite staggering when we think about how many people suffer from sensitive skin. And if we look a little bit at this chart, we are gonna first of all understand the difference between sensitive and sensitized skin, because actually today we're gonna speak more about sensitized skin. But before doing so, we need to understand more about sensitive skin. Sensitive skin has a genetic component, so the factors that trigger this sensitivity in the skin have a base on the genetic heritage that the patient has. And as you can see on my chart, is an ongoing condition. Therefore, we do have these alternating periods between well-being, so calm, and the skin is just, doing fine, and then periods of long-lasting discomfort. So you have these peaks where you have all the disorders and all the manifestation in the skin creating this discomfort. But unfortunately, it's an ongoing condition throughout the whole life of the client, the patient. So they're going to experience this discomfort over and over again, and it's going to be triggered easily by extremely normal conditions, like just going outside and having a little bit of sunshine or cold or just a little bit of wind. Of course, other conditions like pollution, but normal, let's say, conditions in which normal skin will not activate itself and is not going to give you these reactions. When we talk about the reactions that the skin has that are mostly triggered and manifested because of the chemical mediators inside of the skin who are activated, who think that the skin is in danger, so they want to protect it, they are going to give you various manifestations. What I would like to point out, and I want all of us to remember, is that sensitive skin is a syndrome, meaning that in order to diagnose somebody with this condition, they need to, let's say, tick the boxes of more than just one or two of these skin disorders or manifestation. And we have them, the symptoms, we have them in the bottom of the page. We are talking about constant inflammation, frequent flushing and blushing. So you're going to have all this erythema and reddening of the skin. And sometimes if the situation gets worse and it's not treated, it's going to be permanent redness in the skin. We're talking about couperose, or we can talk even about rosacea. The sensation in the skin that the patient is going to feel, and they're going to tell you, it's of stinging, burning, tingling, itchiness. They're going to have also flakiness and peeling of the skin. For sure, they're going to have dyschromia, so they're not going to have an even complexion, but rather they're going to be in some areas red, purple, gray. So dyschromias, sometimes the pimple-like bumps, and dryness. So dryness that can even go up to xerosis. That is a symptom that we're going to discuss today. Again, somebody with a sensitive skin who receives the diagnosis for sensitive skin is going to have all of these symptoms, not necessarily all at once, but they're going to have them throughout their whole life. Therefore, they need to have a special care of their skin. They need to constantly not only calm and soothe the skin, but go to the root of the problem, and that is a very weak barrier of protection of the skin, which allows all of this aggression to be perceived by the skin in a very, let's say, difficult way. The skin immediately reacts to them and gives all of these symptoms. And as you probably remember also from our previous lines when we were discussing about sensitive skin, we also talk about a very hypersensitivity and a neurogenic inflammation that basically, again, keeps the skin all the time in an alert mode and immediately reacts to, again, normal condition, giving us all of these symptoms. Moving on to our basically subject of today, sensitized skin is going to have the same symptoms. So we're still talking about inflammation. We're still talking about extreme dryness of the skin. We're still talking about stinging and itchiness and tingling and erythema, all of these symptoms, but that have a cause. So they are a temporary condition in the skin. They're going to have a severe peak in which the symptoms are just all there and giving a huge discomfort to the patient. But after a while, they will subside, these symptoms. And it's very important for us to understand which are the triggers who are going to create this sensitized skin. Because actually, okay, it's not that 100% of our customers, our clients, our patients have sensitive skin, just a couple of them, right? Although the numbers are increasingly increasing today. But for sure, all of our clients at one point are going to have the problem of a sensitized skin. And that can be triggered by excessive use of active treatments. So here, an example that I can give you are quite strong peelings, medical aesthetical peelings that, of course, are done under the supervision of a doctor. But for that period of time, they're going to give you a sensitized skin. And it's extremely, extremely important what you do in that period before and after in order to help the skin to recover and to fight against that strong aggression. We are talking even about excessive sun exposure. So for countries who have, sun all year round, or if somebody just goes on a holiday and they really, they're grilling in the sun because they really want to get tan and they want to really take advantage, let's say, about their holiday. But doing so, they're going to have a lot of problems with their skin, and they're going to have, for that period of time and after their holiday, a very strong sensitized skin with all the manifestation that we are discussing. Today, they are very common and very popular, all of these aesthetical medical treatments and procedures who are giving us wonderful results. I love them. And I think about lasers, and I think about microneedling, and I'm thinking about plasma pen, derma pen. So all of these more or less invasive procedures, who for that period of time after we are just doing that treatment, again, they are different, obviously, in the way that they are going to work in the skin. They are for sure going to give us a sensitized skin. So again, it is very, very important and crucial to take care of the skin in a very special way in that period. Not only after the procedure, but also before, because I have explained this in the past as well. It is very, very important to prepare the skin if we know that a strong aggression is going to happen in the nearby future. And it's the same thing, and I'm going to give you a very easy example. You can see that I have some throat problems. I was a little bit sick. But if we are healthy people, now we have a healthy lifestyle, we eat right, we exercise, and we drink water and so on. When we are going to encounter a disease, okay, there are many going around, just a classical flu, okay, we're going to get sick, we're going to have all of these symptoms, but if we are a healthy individual, our body, and probably with the help of some medicine, is going to fight off that disease, that pathology, much faster, and is going to recuperate 100% very fast. If we are already, we already have some pathologies, we are weak, like I was saying, we don't have the most good and amazing lifestyle. Once we get sick, the body is going to take longer to heal. And actually, it is very probable that after, let's say, the passing of the illness, to have some symptoms that are going to remain with us for a very long time. It is the same with our skin, the skin that is our biggest organ. So if we know that we are going to have a special treatment, an aggression that is going to happen in the skin, that we are doing in a controlled way because we want to have probably anti-aging effect or whitening effect or whatever is the reason that we're performing that treatment, it is very important to prepare the skin previously to the treatment. Of course, after, it's also important to treat the skin, to calm it, to soothe it, but also to reinforce the skin before having these treatments. Okay, coming back to sensitized skin, another important issue or important factor that is going to give us this problem is pharmacological treatments. And of course, when we think about pharmacological treatments, there is nothing more invasive and destructive to the balance of our skin like cancer therapy. And actually, this is the main subject of our lecture of today, because unfortunately, if we look again at the numbers worldwide, it's a condition that many people are experiencing these days, and has its own factors and are due to the change of our lifestyle and our climate and so on and so forth. And what is very important for us to remember is that during cancer therapy, the skin and the skin appendages, so we're talking about hair, eyelashes, eyebrows, nails, we're going to see them later on, undergo a very huge, great change. They completely change the way that they work, they function, and of course, how they can actually protect our body, because the skin is the first barrier of protection of our body. Luckily, for many patients, the changes can be reversible when the therapy ends, and of course, if it is successful, then the skin and the hair and the nails and everything can slowly, in a more long period of time, come back to normal. The skin can and will feel a sensation of tightness, continuous discomfort, very rough when you touch it, and itchy, sometimes cracked. And again, we're going to see some pictures later on, especially at the ends. We know very well that the hair, eyelashes, and eyebrows can fall off depending on the treatments, but it's a very common side effect of this therapy. And of course, all of these changes are going to have a very negative repercussion on the quality of life of the cancer patient. And today we're going to focus, of course, not only on the physical discomfort, because if you have all of these symptoms in the skin and you have, like I already mentioned, redness and itchiness and dryness, it's uncomfortable or it can be even painful. But the negative repercussions are also from a psychological point of view. I'm just going to mention the ladies now, but of course, men suffer equally, but their perception of themselves when they look in the mirror, it's completely changed because they don't see the person that they used to see in the mirror. So that has a very strong psychological effect on them as well. If we have a closer look to the skin changes, we can see that basically absolutely every mechanism, every metabolism in the skin is suffering because of this cancer therapy. If we look at the very superficial layer of our skin, remember that our skin, yes, it's composed by 3 layers, so the epiderm, the dermis, and the hypoderm. But in reality, we have 4 layers. So from the moment that we are born, the surface of our skin starts to develop, and it's completely covered by something that we call the microbiota. The microbiome basically is a collection, a unique collection that is completely unique to every individual of good bacteria that have a very important role in protecting the skin, in repairing the skin once it's damaged, and they contribute fundamentally to the health of the skin. When a cancer therapy is applied, and we're going to see them in a while because they are different therapies that the patient can receive, one of the first thing that is altered and disrupted is the skin microbiota. So the patient can have a very, like I said, disrupted microbiota, very thin. Therefore, the first line of defense of the skin is no longer there, or it's extremely weak. So obviously that all the aggression that we encounter daily are going to have a very strong impact on the skin. Then going a little bit lower in the epiderm, for sure, the cancer therapies make that the regeneration have a side effect in terms of the regeneration of the epiderm. That is the first layer in our skin. We have these dead cells, right, that need to be renewed every month. In this case, this is going to happen much, much more slower. So the cell turnover is not going to happen normally as it should. More than that, we're going to have a very decreased epidermal thickness. So we're going to have a very thin epiderm. Therefore, again, the barrier function of the skin is going to be affected. Our epiderm is basically a fence, like I call it always, no, or the wall that protects our organism. And actually, the cells that made out the epiderm have strong connections in between them that do not allow anything to go in or out of our skin. We only have two channels of communication with the exterior, and that is one where the hair follicle is coming out, and the other one is where we have our pore of the where we sweat, where the sweat comes out. So these are the only two channels that communicate with the exterior. In this case, by having a very thin epiderm, the barrier function, so allowing to go inside of the skin of all, pollution and many other things being decreased, is going to easily disrupt the skin's balance. Other two things that are altered, that suffer because of cancer therapies, are the melanin production and vascularization. So in this case, obviously, the melanin production, so the melanocytes that are the cells responsible of the production of eumelanin, that is the pigment of our skin, is disrupted. So it's going to have slower, obviously, activity. And also the vascularization of the dermis, in this case, is going to be damaged. Therefore, oxygenation of the tissue, nutrition of the tissue, because with the blood we receive inside of our tissue oxygen and nutrients who are feeding our skin. In this case, they are going to be altered, and that is going to be visible for the patient's skin. Unfortunately, also the collagen and elastin fibers in the dermis are affected. And this is going to have as a side effect a more rapidly aging of the skin, and laxity, and loss of tone and elasticity. There is going to be an increased oxidative process, and obviously, as I was mentioning, a premature aging of the skin. A very increased reactivity and sensitivity of the skin. So the symptoms we were mentioning earlier, the chemical mediators, which we called some of them cytokines, that create, interleukins, who give us the sensation of itchiness or redness or inflammation. All of them are just activated. So the skin's reactivity is going to be very, very high. So the skin is going to have all of these symptoms very easily, even just by touching the skin. The sebaceous and sweat gland are going to be affected as well. And this is one of the reasons why the skin can suffer a very strong dryness. We call it xerosis. So because of the sebaceous gland activity, which is very much subsiding, so it's not really going to produce that sebum. It's not going to be delivered through the hair follicle to the surface of the skin, and it's not going to maintain that hydrolipidic mantle that we need for our skin in order to keep it healthy. And obviously many other processes who are not working and functioning correctly in the skin, then we're going to have all of these side effects of extreme dryness. And of course, since we are still inside of the dermis, we have an alteration of the trophies of hair. So basically, as well as the sebaceous gland, the sweat gland, the melanocytes, everything is slowed down. And in this case, unfortunately, as we all know, the patients are going to suffer hair loss. And actually the hair is going to enter pause, a very quiet period in which is not going to produce new follicles of hair. So they're going to just be on pause, and the patient is going to experience hair loss. And that is a condition that is going to stay with them for the duration of the treatment. Okay, cosmetic treatments seems something that probably is not the first, let's say, word or expression that we think about when we consider or we think about cancer patients, right? Because mostly when this pathology is installed, we think about survival. And this has been the approach till now, especially of the medical community, and it's correct, because as a cancer patient, the most important thing is to fight off the disease and to have the patient survive. Luckily, today, more than ever, the support of dermocosmetic and oncological aesthetical treatments has its own correct role in the recuperation of the patient, and very important, helping the patient to have more compliance with the cancer therapy. This being said, since chemotherapy, radiotherapy, surgery, so all the treatments related to this disease create, as you can see, they all have something in common, and that is the skin toxicity and all of the skin-related disorders. All of them are creating, as I was saying, not only a very, very strong discomfort for the patient, but also they lose, let's say, contact with themselves. They look in the mirror, they don't recognize themselves. So while the, let's say, medical approach, the medical therapy is there to fight off the cancer, the disease, and to ensure the survival of the patient, the cosmetics treatments are there to improve the quality of life during that very, very special period of their life, and to help them continue the pharmaceutical and medical treatment in order to have less undesirable effects on the skin, and to, again, be more in touch with their old self. So today the approach is changing all over the world, and we are very, very happy of that. And actually, I'm very happy that Diego de la Palma Professional has this new approach in our cosmetic treatments. Talking about main classes of drugs, main classes of medicine that are used to treat these patients, we're going to have a look at them. Obviously, this is not a pharmaceutical lecture, but it's very important for us to understand what are the effects of these main therapies that are used for cancer patients. The first one, obviously, is the traditional chemotherapy. It's been used for many years. They are called cytotoxic drugs. And basically what they do is that they target the cells that in our body that are subject to a very strong replication. So the difference, let's say, in between the normal cells of our body and the cancer cells is the rate of replication. So they have a very, very, very high rate of replication, and this is why they are so disruptive. So the traditional chemotherapy, what it does is to target exactly these cells who replicate themselves in a very, very strong manner. But unfortunately, guess what? They are not the only cells in our body who have this very increased activity of replicating themselves. Also, bone marrow has the same replication rate, buccal and gastrointestinal mucosal cells, and skin and hair follicles. So this is the reason why traditional chemotherapy has this very disruptive and toxic effect on the skin, because obviously we are talking about skin and hair, because they also have this replication rate that is very high. Therefore, these drugs are going to have a disruptive effect and a toxic effect, not only on the cancer cells, but also on the cells of the skin and of the hair follicles. The second main class of drugs are much more new, and they are called biological drugs. They are a more targeted therapy. They aim to target the cancer cells in a very specific way because they go direct against the receptor present mostly on cancer cells. So this time the drugs do not, let's say, look for the cells who have this replication rate that is very, very high, but instead they are looking for specific target receptors who mostly are present on cancer cells. So this is going to limit the toxicity throughout the body of the drugs that the patient is going to receive. Unfortunately, these receptors that are present in the cancer cells are also present in the epidermal growth factor, the vascular endothelial growth factor receptor, and often also they are expressed on skin cells and skin appendages like in hair, in keratinocytes that are in the surface of our skin, sweat, and sebaceous gland, and of course, as I mentioned before, in the vascular capillaries. Therefore, obviously, although the toxicity on the body itself, the whole body is diminished compared to the classical traditional chemotherapy, biological drugs that are the new generation of drugs used in fighting cancer have a very, very strong toxicity on skin and skin appendages. So the patients are going to experience all of these disorders in the skin and in the growth of their hair, even probably more than in traditional chemotherapy. Then a third class is going to be the immunotherapy. That is a therapy that re-educates the immune response against tumor antigen. So therefore is not a therapy directly against the tumor cell, but it works on the defense mechanism of the body used against the tumor. And their toxicity is linked to the onset of autoimmune reaction. Autoimmune reaction, which obviously targets our skin as well. Our immune system is present and alive and kicking in our skin, let's say. So obviously, by suppressing this, we are going to have a lot of effects and a lot of reactivity and sensitivity at the level of the skin. And then a third type of therapy that a cancer patient can receive are the hormonal therapy, also called the endocrine therapy. And it is used to treat cancer when growth is stimulated by hormones, so when the endocrine system is involved. And it is based on the administration of drugs that can block the production of these hormones or fight against their action. Hormones are very important, and they are related to the health of our skin in all of the layers. So obviously, once you will receive a hormonal therapy, the skin is going to suffer depending on the treatment, reactivity, sensitivity, and all of the disorders we were mentioning earlier. So although the classes of drugs and the therapies that the cancer patient receive today, let's say, have evolved, have changed during the years, and we are very happy for this. The effects and the toxicity that they have on the skin and on the hair, on the skin appendages, are probably even greater than they used to be in the past. And this, let's say, arises the necessity for us as professional in the skincare industry and in taking care of the skin of our clients, to be more involved, to be aware of this condition, and to start learning how to treat and how to help this type of patients. If we leave on the side the drugs, so the substances that the patient will receive, a second cancer therapy is going to be, and it is widely used, the radiotherapy. Radiotherapy that basically involves the use of often X-rays. So we are going to irradiate the area where the tumor is present. And this obviously, especially on the area, and we're going to see some pictures later on, that is receiving the X-ray irradiation, are going to be, they're going to create in the skin in that area quite severe reaction, and the skin completely changes. It's going to be a localized area where the skin toxicity is very, very high and actually suffers a lot. I'm not going to go into details, but I can tell you that the medical staff who performs this type of treatments, they need to be very, very well trained, because I've seen many cases in which the dosage, the exposure, and so on, let's say, has not really been perfectly tuned with the patient, so they get to have even holes in their skin. So it's not that we have reaction of the skin, we have a complete destruction of that area, which of course has a tremendous effect, negative effect on the patient. Another important thing to remember about radiotherapy, let's say that everything goes well and the dosage that the patient receives is the correct one, are the acute and late side effects. So as you can see here, the acute reaction, so in the moment that the patient receives the treatments, can last, they obviously will happen during the treatment. Redness, erythema, swelling, pruritus, xerosis, so that extreme dehydration of the skin, and blisters, and even, as I was mentioning, necrosis, so the death of the tissue in that area. Hair loss only if the head is treated, but they will be manifesting themselves even within 90 days from the end of the procedure. So again, it's not that I received the treatment today, and if till tomorrow or next week I do not have this manifestation, then all is good, because actually the period of time in which this radiation create these side effects in the skin is quite long. Even more so depending obviously on how many treatments they receive, the dosage, the exposure time. There are also late reactions that may occur even months or years after the end of the therapy. Can be related to pigmentation disorders of hypo or hyper, so they can have either places where the melanocytes are going to create more melanin, so you're going to have dark spots, or in which the melanocytes slowly are going to die, and you're going to have this discoloration of the skin. Dryness of the skin is a very common side effect, thickening and fibrosis of the skin, inflammation, swelling and edema, vasodilatation and telangiectasia, and also loss of elasticity. This is why it's extremely important, and the name of our lecture of today is not only treatment for cancer patients, but also of survivors. So it is important for these patients to take care of their skin in a more special way, even though, let's say, the cycle of treatment has ended, they have beaten the disease, and now they are clinically declared healthy. But the side effects of these treatments can stay with them for a longer period of time. So that is why, even for us, it is important to know which type of treatments we should give them in our cabin and which type of products they should use at home. And obviously, the third intervention that a cancer patient may have is surgery. Surgery that can happen before, after the other treatments. Obviously, the most common consequences of surgery are mainly scars, a different body image. Imagine if we are taking out certain parts of the body. And for instance, removal of the breast and the lymph nodes can also very often be accompanied by a lymphedema. They can have the swelling of the arm. And of course, also in their case, they need and they want to have the help of a professional to get again in touch with their body, with their skin, and with themselves. And here is a more detailed way of how every single therapy used for treating cancer influences the skin and hair and skin appendices. Obviously, the side effects are much more than this, but we just take a closer look to the skin. If we talk about traditional chemotherapy, as I was mentioning before, you're going to have for sure hair loss, hand and foot syndrome, and just bear with me because we're going to see later on some examples and we're going to understand it better. Xerosis and pruritus, so they for sure are going to have this side effect of extreme dryness of the skin. This is what xerosis is. Cracks in the skin, macropapular rash, swelling of the face, and problems with their nails. Again, we're going to see it in a while, called paronchia. For the biological drugs, more targeted therapy, we were mentioning earlier of the receptors found on the cells, cancer cells, we are still going to have hair loss, but also folliculitis, also hand and foot syndrome, and a very dry skin and macropapular rash, problems with their nails, phototoxicity, and keratosis pilaris. So they influence a lot, as you can see, even more than traditional chemotherapy, the balance of the skin and hair and the skin appendages. Also, for immunotherapy, since we are unfortunately working with the immune system of the body, we're going to have folliculitis, xerosis, and swelling of the face, and paronchia, but also vitiligo, that is a disease who basically creates the death of the melanocytes. So you're going to have all of these areas without pigment all over the body. Psoriasis-like syndrome, and this is another quite disruptive syndrome in the body, and erythroderma and many other manifestations related to the skin and hair. Hormonal therapy, we can have macropopular rash, and vitiligo can be a side effect. For radiotherapy, for sure, as we were seeing earlier, the effects are many, even including necrosis of the tissue. And of course, for surgery, scars and the changing in the appearance of the person. These are the main therapies done to a cancer patient, and the side effects that they have at the level of the skin and the skin appendages. Now, I want to go over the professional products that we have in our new line, in our new Soothing line. Therefore, later on, we can understand which of these products we can advise our customers, how they should be used, and for every single problem that we have just seen, every side effect, how we can alleviate the pain and the disorder that the patient has throughout the products that we are using. So the new line of Soothing of Diego de la Palma Professional starts with a professional product that is the micellar cleansing water. This is a very easy to use product. It does not involve the usage of water, classical water, to remove the product. So it's very easy to use. And actually for them, for cancer patients or for people who have a strong sensitivity in their skin, the usage of normal water, tap water, is going to create a reaction in the skin. So therefore, using a micellar cleansing product, it's very suitable for them. You just put it on 2 cotton pads and you remove everything that is on the surface of the skin. It does not disrupt even more the hydrolipidic film of the skin and the physiological pH. It's fragrance-free, so you do not have any perfume inside and any other ingredients that can give a reaction of the skin. And actually, if we look at the ingredients, we have provitamin B5, so panthenol, the ProSense peptide that we used to use also in the old line that calms the neurogenic inflammation. Ectoin, that is an ingredient which I absolutely adore, and maybe with another occasion we can speak more about it. It's an ingredient found by scientists in a very on a microorganism at a very big depth in the ocean, where life actually is not possible because the environment is not very friendly. And actually, these microorganisms survive there because their membrane is surrounded by the substance ectoin. Ectoin loves water, so helps the microorganism at this very strong environment condition, very cold, without sunlight, to survive. It does not lose the water inside of the cells because the ectoin preserves and protects the body of the microorganism. And the last ingredient, the resurrection sugar, or trehalose, that creates this, let's say, mantle, if we can call it, on the surface of the skin, again, protecting it and preserving the moisture in the skin. So just by using the micellar cleansing water, the patient immediately feels a little bit of relief. The skin starts to calm down even from just the simple act of cleansing it. And a little bit the hydrolipidic film and the hydration of the skin is a little bit restored. Second professional product that we are using in our professional treatment is the renewing massage cream. Now, this is a very special product, and I think through all of the other products, it's a very important product for the patient that is suffering from therapies against cancer. Why? Because we were mentioning earlier, if you remember, that their skin renewal is slowed down. And this has obviously a disruptive effect in the skin. But on them, you cannot perform mechanical peeling, enzymatical peeling, chemical peeling, for sure not. So throughout our normal classical ways of exfoliating and helping the skin to renew, we cannot help them. And here is where this product really comes into place and really helps us a lot, because this is a very soft way to help the skin renew itself. It's a cream, like the name says it, in which basically you apply it onto the skin. You leave it in pose for a couple of minutes and then just slowly and very delicately start to remove it. And actually, as we're going to see later, we use it in our specific massage, if we can call it a massage, for the cancer patients. But by using this product on the skin, because of its ingredient, the urea 2%, that, let's say, breaks down those connections in between the dead cells. And then if you look at the other ingredients that are extremely nourishing and moisturizing, you soften, you moisturize, you nourish these dead cells. Therefore, when you are going to just remove the product, or you're just going to massage the skin in a very soft way, these dead cells are going to fall off. They're going to fall down from the skin. And here I always give a very easy example so that we can understand how the principle works. If you eat something out of a plate, and maybe you don't feel like just washing that plate right away, so you just leave it there. When you go later on to wash it, you will have all these food residues that do not come out, that they don't come off from the plate, no? So it's really difficult to wash it. So what do? We just put a little bit of water in the plate and probably just some soap, leave it there for a couple of minutes to soak, right? And then once we come back to washing it, actually just by the running water over the plate just makes that food residues to come off. It's the same principle here. What we are doing is helping the skin renew itself by moisturizing and just softening those dead cells on the surface of the skin so that they can fall off much more easily. And in this way, in a very gentle and soft way, we help the skin to renew itself. And that's why we call it a renewing massage cream. Always fragrance-free. Then our third professional product is the mask, the Nourishing and Soothing Ceramide Melt-In Mask. Now, this product is wonderful to soothe and calm the skin, especially when it's in an acute moment where you have all of this discomfort. It's a creamy texture, white in color because it contains the zinc oxide. Very moisturizing as well, and full of the Ceramide Plus CPX ingredient. Now, this ingredient, the ceramides, are actually very interesting because they are created in the laboratory throughout biomimetic science. The biomimetic science is the science that studies the natural processes in nature, and in this case, in our skin, and imitates them in a perfect way. Therefore, these ceramides, they have the same size, the same shape, the same consistency and same composition as the natural ceramides in our skin. And for sure, you know that the ceramides in our skin are the bricks who are basically creating our skin. And for these patients, obviously, they are damaged. They have places where they are not really there to protect the skin and to create this very strong wall of protection for the skin. So by using this ingredient in our product, not only in the mask, but also in the other products, we give the skin these identical ceramides to fill in the blanks and to reinforce the skin. And actually, just another detail about them, they are delivered inside of the skin with the help of biomembrane technology that helps us deliver these ceramides exactly to the point inside of the skin where we need them, like I was saying, to fill in the blanks that are caused by the lack of ceramides there. Normally, we will apply this mask for 10 minutes and then remove it, but we're going to see the protocol in a while. And then for the next step, after we remove the mask, we have two options, two serums that we're going to use, probably one more than the other, that are going to help the skin to recover. The first one is the Deeply Nourishing Anti-Aging Serum. So you have your 50 ml airless bottle full of cola leaf 18, so with a strong anti-aging action, promoting the production of collagen 18, processed peptide, ceramide plus CPX, and ectoine. We're going to use this serum when the skin is not experiencing and is not manifesting strongly, acutely, all of the symptoms we were mentioning earlier. So probably the patient has finished with their treatments, they are in a more stable period. So we really want to give them that anti-aging effect, because we saw that these treatments and this pathology is aging prematurely the skin. And this serum can help us in that direction. But if the skin has all of the manifestation we were talking about earlier, for sure, our gold star product, our SOS product, is going to be the Soothing Anti-Redness Serum. I love this product. I use it on a lot of my patients. It gives an amazing effect immediately after being applied to the skin, and it has been created to soothe immediately the redness in the skin. It contains the anti-redness complex that is specially created in order to soothe the erythema. And it's specially created also for cuperose-prone skin, irritated skin, due to pharmacological and antibiotical therapies, but also exposure to irritants like sun and wind and cold and so on. I really, really like this product. If there is permanent redness in the skin and you keep on using this product, because actually the same product there you can give also to the customer at home. We're going to see it in a second. If you use it every single day, morning and evening, it really improves substantially the condition of redness in the skin. So for me, this is for sure a star product, which I absolutely adore. Both the Soothing Anti-Redness Serum and the anti-aging one contain this high-tech primary packaging, who has basically two main purposes. The first one is to better preserve the formulation inside. So especially when we're talking about products who are going to be used on sensitized skin, even more for somebody who's undergoing cancer therapy, so their immune system is zero, it's very low. the products should not have the opportunity, if I can say like that, to be contaminated. So the packaging should not be something that I open, I close, it gets in contact with air, or I put my hands inside. For sure, that is a very bad approach. This is why we chose to have this packaging in which we have no air intake, and there is a total separation between the product and external packaging. And throughout the airless pouch technology, you just use the product little by little till it's completely consumed. And another important reason why we have used this type of packaging is because it's friendly with the environment, because actually once you finish the product, as you can see in the pictures below, you are going to unscrew and pull and separate the pouch from the external bottle, and when you're going to throw them away, you can easily recycle them. So that's also something useful to preserve the a healthy environment around us. Okay, final step in the professional treatment is going to be the application of the Soothing Eye Contour. Again, a fragrance-free product, and besides of the normal ingredients we are using in this line, we also have the B-circadine ingredient that helps us reduce the signs of fatigue and puffiness and dark circles, especially the one who are caused by blue light, an unhealthy lifestyle. We are all day long in front of a computer or a phone. So it's really, this ingredient helps with this manifestation. But it's a very gentle, very delicate, very soothing product for the eye contour, who, of course, is one of the most sensitive areas. So we really need to have something special to treat this area. Then we have the deeply nourishing and soothing cream. And if you have a look at the ingredients, the first ingredient there are the ceramide plus CPX. So it's a product full of ceramides. Once you apply it, you actually reinforce the barrier of protection of the skin. It calms also the skin, and it creates this protective and moisturizing layer, giving a lot of comfort and soothing to the skin. Obviously fragrance-free, and a very, very, very nice product to be used during the day. And once I finish my professional treatment in the cabin, and that is the Uniforming Tinted Cream SPF 50. So high protection. This product, who is also in the airless pouch technology, contains these very light mineral pigments, who are giving just a very delicate sun-kissed pigment to the skin, just to give it a little bit of uniformity. So if you have some discoloration, some dyschromias, it's going to just help you a little bit mask them. But it's for sure, it is not a makeup product. It's just going to give you this, like I was saying, a little bit of uniforming. That's why it's called actually uniforming tinted color. But the most important thing about the product is the protection that it gives you. It contains very, very stable last generation filters with an SPF of 50. UVB, UVA, infrared, and blue light. So you have a complete protection for the skin. And please don't forget that especially a skin that is receiving these pharmaceutical treatments, who's undergoing cancer therapy, is a very photosensitized skin. Therefore, it needs protection against all of this sun radiation. Therefore, this patient must have this type of protection all the time. So it's a great asset to our range. This
Sorry,
is
I
the
just want to interject for one
Yeah.
second about the uniforming tinted cream, because we've had this question a lot about the mineral pigment. The pigment works
Mhm.
for all different skin types and all different ethnicities because it's one universal shade, like you were mentioning. It just brings down the redness, just gives an even look to the skin, but it's not
Mhm.
a makeup. So you don't need to
No.
worry. It works on every skin tone and every skin type.
And actually, I've tried it. I've tried it on a very bright, very white skin, but
Right.
also more dark skin. But again, it's just to trick a little bit. It's an optical illusion
Yes,
because
yes.
it plays a little bit with the light. It reflects a little bit the light off from the skin and just gives you a more even complexion. But it's not a makeup product for sure. Its main purpose is to protect the skin against UVB, UVA, infrared, and blue light. So I would mention this, but now we're gonna go to the professionals, home care use. I would mention that even if let's say I'm not gonna go outside of my home today, so I'm not really going to expose myself to the sun, during the day, I will be using this product, especially if I'm gonna stay in front of the computer all day long, in front of my phone, because I need protection against blue light. Okay, so these are the professional products that we use in our professional treatment. And my computer just froze. Okay, here it is. And since we have seen these products, and I'm gonna go back, sorry, yeah. Out of all of them, obviously, except from the mask that we are using inside of our cabin and the renewing massage cream, the other products, all of them are formulated exactly the same to be used at home. And since I've mentioned this, I would like to go through with you some of the oncological skin-related disorders and customized advice examples that we can have for each of these patients. Of course, the following dermocosmetic advice should not be, replacing the treatment that the patient is having, okay? Not to replace the pharmacological treatment. They are just there to support and to help the patient go through this period much more easily and to help them with all of the symptoms that they have in order to, like I was saying, be more compliant to the treatment. If we talk about hair loss, in this case, we already understood that it's a very, very common occurrence in this patient. Luckily, it's usually reversible. Some people's hair only grow thinner, but for sure this is a manifestation. But not only hair loss, but also the skin on their head is going to be much more sensitive. So we can have some advice for them, because just let me just mention one thing. Imagine you are going through this very tough situation and you go to the doctor and they will give you the diagnosis and they will make the treatment plan for you. But in order to help you alleviate all of the symptoms, probably, then of course it depends on the country you are in and which type of medical system you have, but probably the doctor is not going to stay there and explain to you how to take care of your hair and your skin and how to moisturize it and how to subside the symptoms. Again, they have been trained and their purpose there is to help you fight the disease and to ensure your survival. So for us in our aesthetical role that we have, if we want to take on this type of patients, and I encourage you to do that, because as I was saying, the mentality has changed a lot and many Many doctors are now, as you're going to see later, are encouraging patients to go and seek this help in order to subside with the side effects and to get in touch again with themselves. So it's up to us to give them this advice, which are very simple. For instance, here you can see they can use scarves and turbans in natural fibers, wigs, but depending on the wig, to cut their hair very short before starting therapy, because if they have long hair and it starts to fall off, it's actually very traumatic. Do not brush very often and very vigorously. Do not wash your hair very often, probably 7-8 days. And then to use products which are very delicate, small amount of mild shampoo, and to use lukewarm water rather than hot water. And of course, if we talk about the hair of the eyebrows and eyelashes, to use corrective makeup, and we can teach them how to do that if we know, of course, how to do it. And of course, to completely avoid aggressive treatments such as dyes, bleaching, ironing, and permanent for the hair. This is for the scalp and the eyebrow area and eyelashes. If we talk about xerosis and pruritus, who are again very common skin reaction for these patients, they will be characterized by dry, very dry skin, flaking, and of course it's gonna have this feeling of tingling and often itchiness because of this extreme dryness, and which is going to have, as I was mentioning earlier, a very disruptive effect on the barrier function. What we can do is to cleanse with specific products who do not alter the physiological pH, who take care of the hydrolipidic film. Does that sound familiar? To moisturize and to restore the lipids in the skin, and ceramides especially. To use products who are softening, who take care of removing the dead cells, you see there, using urea. So this is an ingredient very well known to help with this condition. To use sun protection, high or very high, and of course to avoid hot environments or very cold environments, which can cause, and also excessively warm clothes, which can cause itchiness. In Diego de la Palma Professional, we have specific products for treating xerosis, and I think you already understood this. So our micellar cleansing water is ideally to cleanse the skin with this problem. The deeply nourishing anti-aging serum will help you a lot with nourishing that area. Eye contour and the 24-hour face cream also will give the skin exactly that moisture that they need, and will alleviate the symptoms of xerosis. And of course, the uniforming tinting face cream SPF 50 was going to help us a lot to protect the skin. I haven't mentioned earlier, but I'm going to do it now, that we didn't only create products for face, but also for body. And in this sense, we only have two products, a cleansing oil body and dermal lipo-rebalancing body cream, both of them specially created for this type of skin. So the cleansing oil body you're going to use in the shower. You're just going to get your skin wet, and then you're going to apply the oil, massage it thoroughly. So it's going to be your cleanser in the shower, but it's also going to restore again your lipids on the surface of the skin, and it's going to moisturize and nourish the skin deeply. After the shower, applying the dermal lipo rebalancing cream is going to really help take care of the itchiness and the extreme dryness. So both of them are ideally products for people with this condition. Folliculitis, again, you remember it was a very common side effect of the treatment, located mainly in the seborrheic areas of the face and on the torso. We can see the picture there. It's a very common occurrence. Very important the cleansing product that we're going to use. Do not rub the skin. To use moisturizing and soothing creams with a very light weight, so texture who are easily absorbed in the skin. In the case of, and you see how it's written, limited sun exposure, always apply a broad spectrum of protection and very high protection. Always corrective makeup if there is no ongoing infection, and avoid wearing very tight fitting clothes and made out of synthetic fibers. By the way, it's written down here, and I was going to mention this later on, but I'm going to do it right now as well, that you need to really be paying a lot of attention to the hygiene of the brushes, sponges, other accessories who are used in contact with the skin. And I'm going to take a moment here to mention the fact that whenever you're going to have this type of patient and you're going to perform the professional treatment in the cabin that I'm going to show you in a second, you must pay a lot of attention to the hygiene, more than ever with any other patient that you're going to have, because their immune system, remember, is suffering a lot. It's really not there to protect them. So washing our hands thoroughly, probably using gloves, making sure that our brushes, our spatulas, our bowls, everything we are using during the treatment is cleansed thoroughly. It is extremely important to be aware of this and to pay attention to the hygiene when treating and dealing with this type of patients. Again, coming back to our home care products that we can use for cancer patients who have the problem of folliculitis. Obviously, our micellar cleansing water is ideal for them. The Soothing Anti-Redness Serum, in this case, helps a lot in calming the skin. And the Soothing 24-hour face cream and the Uniforming Tinting face cream SPF 50 are ideal to be used to protect and to help the skin to restore itself. And if the problem persists on the body, both the cleansing oil body and the dermal lipo-rebalancing body cream are ideal to treat these symptoms. As well, for the macropapular rash, and here you can see an example. They have frequent itching, they have erythema, and they're going to be present on the face, back, palms, soles of the feet. In this case, we need always a gentle, low foaming cleanser and moisturizing and softening with urea creams. Easily absorbed textures, so not heavy textures, and avoid products that can cause skin dryness, for instance, with very high alcohol. Limit your sun exposure to minimum and always use high protection and a broad spectrum of protection. In this case, and I'm not going to really just tell them again, we have the perfect products, starting from cleansing to treatment to photoprotection and also for body, who are ideal in texture and in ingredients for people who are having these skin disorders. Hand and foot syndrome, I was mentioning earlier, and again, you can see some pictures there. It's characterized by redness and burning and swelling and pain in the palms of the hand and soles of the feet. Sometimes the skin may have cracks or ulcers, and the locations seem to be linked to a greater presence in this region of the eccrine glands, from which drugs are partially secreted. So again, for these areas, you need to use highly moisturizing softening creams with urea. You can see they have flaking to avoid, pressure or friction on that area. Avoid standing on your feet for a very long time. Wear very comfortable shoes, natural fibers, and freshen hands and feet with cold water bath or damp clothes for 15-20 minutes and moisturize that area. Avoid sources of heat and direct exposure to the sun. In this case, we have the cleanser, which is ideal for this condition. We have the body cream, but also the soothing anti-redness serum. So we need to go a little bit outside of our not necessarily comfort zone, but we need to understand that if the soothing anti-redness serum does wonders on the face for those areas who have a lot of swelling and redness, it can easily be used also on the body. So nothing stopping us to do that. And for the hand and foot syndrome, the soothing anti-redness serum actually is ideal. And since we are still on the topic of hands and feet, another very common disorder that is going to happen is the paronychia. So this inflammation of the periungual tissue with redness and heat and pain along the nail fold, and unfortunately often associated with bacterial infection. If there is a bacterial infection, obviously they would need pharmaceutical treatment. But for us, what we can do is to use the gentle cleansing oil body and the soothing anti-redness serum. So we have specific products that they can use for this issue. Phototoxicity, the skin is sensitized when exposed to sunlight, and this is going to happen all the time, both because of radiotherapy, but also of chemotherapy. So for sure, in this case, you need to use, as I was explaining earlier, a high protection and a broad spectrum of UV filters for the skin. And we have our SPF 50 with a very light texture, but very strong in protecting our skin. And you can see here, it's as a general tip, it's written, cover the areas exposed to radiation therapy for 6 months after the last treatment. I would go even further and say to always use protection, as you know, but especially after finishing the treatment, it's very important to protect the skin. Radiodermatitis, of course, that picture there, it's quite strong. Radiation has a lot of effect in the skin. Now, I would like to point out a very important thing, because you can see here we have a classification of the skin reaction depending on the, of course, level of radiation, time of exposure, number of sessions. You can have just a faint erythema, some dry desquamation, some decreased sweating of that area, or bright erythema, patchy moist desquamation other than skin folds and pitting edema, or you can have, and I think it's between 3 and 4, what we are seeing in the picture, ulceration, hemorrhage, and necrosis. So obviously, it is not our recommendation that if you have a skin with necrosis, with hemorrhage, with ulceration, to apply a cosmetic product, okay? Obviously, we apply our professional products on an area who is still being, what would be the word in English? Still whole, so we do not have breaking in the skin, okay, and who is inflamed and red and dry, but not like the one we have there in the picture. So we need to evaluate But for sure, this is caused by radiation. But for sure, on the rest of their body, we can use the soothing line without any issues. And here are some advice for people who are undergoing radiotherapy, not only for that area, but also for their entire body, to use a gentle low foaming cleanser, moisturize and soothe the cream, limit sun exposure, and always use a high protection sun filter, avoid wearing very tight and fitting clothes, avoid excessively high or low temperatures. The skin must be cleaned and no cosmetic must be applied on to that area who has been radiated, and we're going to do that for the previous days. And to during the therapy, to pay attention on the physical irritation, mechanical irritation, and chemical irritation of the area. But we do have our specific products, starting from the cleanser, going to the anti-redness serum, face cream, and the SPF 50 for face, and then for body, the oil, cleansing oil and body cream, who can be used without any issues to treat the skin. Swelling of the face, this can be caused by chemotherapy and immunotherapy, and can result in this swelling and edema on the extremities and sometimes on the abdominal area. What we do here, we use a specific cleanser and moisturizing and softening creams with urea. And of course, lifestyle is going to be changed, but here a nutritionist, a dietitian is going to be the one helping the patient. But we can always give them the advice to reduce the consumption of salt and salty foods. And for scars, obviously, take care of that area, moisturize it, limit sun exposure, use a high SPF, and of course, we have the products to help you with that. So this is a recap of what we were mentioning till now. These are the most frequent skin problems in cancer therapy. And you can see our products for face and for body, and which ones can be used for xerosis or for folliculitis or for hand and foot syndrome. So these are the most common problems that we're going to find, and we have a solution for each one of them. Solution in the sense that we can alleviate the pain, we can help the patient diminish the symptoms, and as I was saying earlier, be more compliant to the treatment to the very end. And I like very much this quote that says, curing the disease also means taking care of the person with a holistic approach. The mentality till now has been take care of the disease, kill the cancer cells, and somehow make the patient survive. But today we understand, and studies have shown that integrated programs for managing this disease have a higher rate of success with these patients. So we are talking about professional treatments and aesthetic massages to give up psychological relief, cosmetics that they will use at home, corrective makeup. And of course, here, if we talk about this team of people who are working with oncological patients, we can also include, as I was mentioning earlier, the dietitian who is going to help the patient with this aspect of their life, the psychologist who, of course, is going to help them with all of their emotions and everything they're going through, and of course, the doctor who is treating them for their illness. It's a combination of professionists who are working to help this patient fight the disease, but still, carry on as much as possible a normal life. The role of cosmetic treatments has increased substantially in the last years. I don't think you are seeing very well my table over there in the right, but I can tell you that depending on the degree, you see there it's grade 0, 1, 2, 3, and 4. That is basically the recommendation and what the patient needs to do. In all of them, we have written down specific dermatocosmetics. They now are suggested, they are recommended by the doctors in treating all of the skin disorders. And I'm telling you that this is something a little bit more new as approach. I'm not sure in Canada how things are working, but even here in Europe, it's a more new approach because again, I'm repeating myself. In the past, the doctor was just giving you the medicine, the chemotherapy, the radiotherapy, and that's it. So it's not going to really prescribe you or give you a consultancy about your dry skin or the loss of your hair or the itchiness that you have in the skin. Today, the approach is changing, and this is really something that we need to be on board with, and we need to understand how to help these patients. The role of cosmetic treatment is very important. It helps to limit the collateral aesthetic related effects of the medical treatments, and at the same time to relax the mind and body of the patient, to give them these moments of relief, of getting in touch with themselves all over again. And our line, our new Soothing line, is perfect also for oncological patients, not only for people who have a sensitive skin. Why? First of all, because of the effects that it has in the skin. So it was specially formulated to moisturize and nourish the skin. And remember, for this patient, this is one of the main problems, extreme dehydration and xerosis. It has been formulated to reduce the sensation and discomfort like itchiness and tingling in the skin. It soothes redness, it reduces the oxidative stress and this accelerated aging process that happens, and contains products that have a high protection and a broad protection from the sunlight. So all of these effects are exactly the effects we are looking for in products to be used on oncological patients. The second reason is that we have inserted in our formula a limited number of ingredients. Why? We have formulated our products like this to provide a high tolerance and comfort for a very extreme sensitive skin. So if you use a lot of ingredients, for sure, the risk of having a reaction to one of them is higher. So in this case, we have selected very, very carefully every single ingredient to really be effective on the disorder that the skin has, but we have limited the number of active ingredients we are using. And for this reason, the Soothing line does not contain the 51+3 Hyalu complex that you know is a trademark ingredient, very common in the DDP professional line. Tested tolerability formulas who are suitable for extremely sensitive skin, dermatologically tested on cancer patients, and later that we are going to see also the efficacy test. Actually, what we did is to test our products also on cancer patients. Again, ingredients with an optimal toxicological profile, regardless of their natural or plant origin. So we did also test it for heavy metal, like to have very low contents of chromium, lead, mercury, arsenic in the ingredients we are using, alcohol-free and low foaming agents, and also fragrance or allergen-free ingredient, again, to not give a reaction on the skin. Targeted active ingredients, remember we were going through them earlier, the processed peptide who reduces neurogenic inflammation, the ceramide plus CPX, and the ectoine, specially formulated for the disorders that the skin have in this moment. Proven efficacy, so you know that for every single line we do this clinical test, even more for this line. What is new in the clinical test that we have performed here, and you see some pictures and we have a lot of information about the clinical test, is that we also did the clinical test on oncological patients in the University of Naples, so under the supervision of dermatologists, because we really wanted to prove the effects that they have on an oncological patient. So the skin appears healthier, a reduction of xerosis, fragility, and itchiness in 100% of the patient tested, increase in skin density, in hydration, both for face and for body, and even wrinkle reduction, although, as you can imagine, we are not considering this line as an anti-aging line. But since the oncological treatment has this side effect of premature aging of the skin, some of the ingredients and the approach that we have in the treatment will reduce these signs of aging. And the fifth reason why this treatment is specifically made also for oncological patients is the fact that we have a specific protocol with specific massage technique developed with a specific clinic in Rome that is treating only oncological patients. So together with them, we created the protocol and we created the massage. You can have now, and I will show you that we have everything written down for it. In this way, to make sure that not only obviously the formulation of the product is working and it's ideal for these patients, but also the approach that we have, the manuality, how we are doing the massage, how we are applying the products, because they have this long experience in treating oncological patients. So they really gave us their expertise for this type of treatment. What is the professional protocol for the oncological patient's skin? So the first 2 minutes, we're going to use the micellar cleansing water onto cotton pads. Roughly 10 ml are going to be used without rinsing off with water afterwards. So just use the micellar cleansing water and that is enough. Afterwards, we're going to use the exfoliating renewing massage cream. We're going to apply it onto the face with a brush, a clean brush, and roughly leave it for 2 minutes just to act. And then for 10 minutes, we're going to do the specific massage for oncologic skin. I'm going to show you, we have a video. It's actually a very easy technique. And I'm going to come back to it in a second. Then remove the product, okay, and then apply the mask, the nourishing and soothing ceramide melting mask. Leave it 10 minutes in pause, roughly 8 ml of product. Remove the mask, and then according to the needs of the skin, I was mentioning this earlier, we're going to apply either the soothing anti-redness serum or the deeply nourishing anti-aging serum. 1 ml, very, very lightly applied and massage into the skin. On top of that, we are gonna apply for our final step, the soothing eye contour, and then the deeply nourishing and soothing cream and the uniforming tinted cream with the SPF 50. The duration of the treatment is around half an hour, 30-35 minutes. So it's quite pleasant, it's quite a fast treatment, giving them exactly what they need for the skin. The specific massage, as I was saying, it's a very relaxing and a very gentle, and I'm going to say it again, gentle technique. We developed, as I was saying, this massage with our colleagues in Rome. Every movement, it is done in a very gentle way. I would say that even the word massage, maybe it's not correct in this case. And we have the specific protocol. Every single movement, it's written down, so you can receive this from our colleagues in Canada. But also we have our video in which you can see exactly all of the movements that they're going to have. Just pay attention, and I'm going to say this again, that every single movement, it is done in a very gentle way. You repeat every single movement that you see now in the video for 3-4 times, but please, again, do not apply a lot of pressure. So every single movement, it is done in a very gentle way. The purpose of the massage is to help the patient relax, is to help them, again, get in touch with themselves again. Sometimes if they're going to have certain manifestation in the skin, which are, painful, so the skin is really in a bad shape, I'm not going to insist with the massage. If there are areas, and we have a detailed video of the massage I was just showing you, so you are going to go over sometimes even the neck and décolletage area. But of course, if some of these areas have been treated maybe with surgery or with radiotherapy, I'm going to avoid them. I'm not going to touch the skin in that area. But for many of them, we can perform these specific movements that you're going to have detailed in the video step by step. Just again to give them a 10-15 minute, if you want to make it a little bit longer, of just a technique of relaxation for this patient. We call it the SMILE work protocol. So this is the name we have given to the treatment for the oncological patients, the SMILE work protocol, and you have it written down step by step. We have already seen it in the beginning. Okay, so a lot of information. We still have 15 minutes to go to the full 2 hour of our webinar, and I know it's a lot of information. What I would like to tell you is that to work with this type of patients is an amazing experience. They are wonderful people who really charge you a lot, so it's something wonderful to give them back these moments of relief, of relaxation, and to really see the happiness in their eyes, because now they can finally take care of their skin and to feel the relief for a brief moment. I see some questions in the chat that I haven't had the time till now to have a look, so I'm just going to look right now. Okay, so do these products help with pigmentation damage for having basal cell removed by craniotherapy, example skin lightening? For sure, they will help you make the skin more coherent to increase the skin barrier and to protect it also from the sunlight. So you have the SPF 50 is going to help you for sure a lot afterwards. So for sure they help. Are the body products safe for babies as well with skin disorders? Lovely question. I love the question. So I've been testing them on my children as well. Yes, the products are suitable for children, for infants, and also for pregnant ladies. Unfortunately, yes, if I'm coming back to children, there are many children who are suffering from dermatitis, atopic dermatitis from a very young age. And especially the body products are amazing. They work perfectly, so you don't need to run to the pharmacy to buy those specific cleansers. You can use the cleansing oil, which I already have, and dermo rebalancing cream for children, and they work wonderful. I used them after we went on holiday, after we got a little bit more tan than we wanted to, because with children it's impossible to take them out of the water. So I just, used them in the shower and the cream, and in the morning they were perfectly fine. And the Soothing anti-redness serum has really helped me a lot in many situations. Okay, how do you recommend we let the public know we do this service? This is a very good question. Of course, it's not that we advertise that we want to make, profit from from this type of treatments. Probably social media is a great tool. I would recommend you to just say that you have specific special product to be used for oncological patients that have been clinically tested. I would always mention this because we have scientific facts behind it. So it's not just something that we think it's good for this type of patients. We have a specific professional treatment who has been developed with a specific clinic that is treating oncological patients. And we have specific products to use at home for this disorder. So I would always mention and emphasize this, but I'm sure the guys from Intercosmetics can help you with some ideas in the direction, and we can brainstorm for this. Okay, do you suggest we get in touch with the chemotherapy department at the hospital? I mean, depends on how open they are. There are many hospitals who are open to this type of collaboration. So if you think you want to do that, I would for sure encourage you, because the more complete the team is that is treating this patient, the bigger the success is going to be. So if they are mentioning to the patient that they should go to a psychologist, to a dietitian, for sure they need also our help. So yeah, why not? Can the body cleansing oil used for the face? It's not a problem, you can use it, but for face, also the micellar water really works wonders. For face, if I'm using the cleansing oil, I've tried it. It's not a novelty for me. We need also to use water afterwards to remove it, because it's an oily product, so you do need to remove it with water. And sometimes, because some of these manifestations, the disorders, are going to be very present on the face, the water can create a disruption in the pH, and it can give you some symptoms. So maybe we can stick with the micellar water. How two serums, anti-redness and anti-aging, are different? I'm not sure if I completely understand. One, it's focused in the active ingredients. It has the anti-redness complex and other ingredients who are soothing and calming, but its main purpose is to reduce erythema, redness. That's why it's called the anti-redness serum. So the ingredients work on the, blood vessels, maybe it's a lot on the capillaries, and they reduce immediately redness, the sensation of heat in the skin, and the tingling sensation. So whenever you have, I can make a parenthesis, I'm using the anti-redness serum even after I'm doing a waxing on the face, or after I'm doing laser for hair removal, that, for face especially, it gives you a little bit of redness, which is normal. I immediately apply this product, and it's like magic because the redness immediately subsides. The anti-aging serum, as I was mentioning, has the cola leaf 18 inside. So if my skin is in an acute moment where it's red, it's itchy, it's swallowed, probably stimulating the skin with the cola leaf is not the best solution. But if now it's in a more stable situation, I don't have all those manifestations, rather than using the anti-redness, I would prefer to use the anti-aging serum, because, you know, our skin, especially if we are going through this treatment, is aging rapidly. So I do want to have that anti-aging effect. But of course, it's not my priority, because if I have wrinkles and laxity and redness and itchiness, the priority is the skin, the redness and itchiness, and afterwards I'm going to think about the wrinkles and the sagging skin. Okay, it's normal, it's the priority. So this is how you should, let's say, use them and understand these two products. Okay, I think these are the questions. Anything else?
Everything. Thank you so much, Alexandra. That was wonderful and so great to have your expertise in these products in particular. I know we've had a lot of questions about them and how to use them, and particularly the oncology. So this is wonderful to get this really detailed training from you. Thank you so much. Oh,
it was really my pleasure.
Sorry, I see one more. I see one more question that's just been added.
The internet is doing a little trick.
Yeah.
Yeah.
There's one more question.
Going anywhere.
It says, for the removal of products.
Okay, for removal of products, would you recommend? Could be. Yeah, I have nothing against it. Could be a good good option. Absolutely.
Okay. All right. I think that's it, unless there's any other last minute questions.
Yeah. Just remember, we are here for you. So when, well, probably there are going to be other questions who are going to come in your mind. I really strongly advise you to try the products. We give you all the information. So the guys of Intercosmetics are more than happy to give you all the materials and the protocol and the video. And we made things simple. We do not like to complicate them. Okay. But just to let you know that in many countries already where we have this range up and running in in the beauty salons and beauty institutes, our clients are very happy, and many of our estheticians were very happy that now they can finally treat also this type of patients that till now they were saying, no, sorry, I don't know what to recommend you. I don't know how to handle this situation. So we are very, very happy with the new Soothing line.
Yes. And for anyone who gets started with the Soothing line, we have the technical dossiers, we have videos, we have product information sheets, and all of that for your training and for training of your staff and for your own knowledge. And we also have a lot of marketing materials for you, like brochures, images for social media videos, all kinds of things that you can use to help promote that you are offering this treatment in your business. Okay, well, thank you so much, Alexandra. And if anybody has any questions after this webinar, if there's anything else that comes up as you're using the products, please don't hesitate to reach out. You can contact us at our head office or send an email to our office. You can reach any of us at office@intercosmetics.ca, and we'll be able to get back to you with any questions. All right, well, thank you so much, Alexandra. Thanks again.
My pleasure. Have a wonderful day, everybody.
For anyone who's going to be coming to the Toronto ESI show, we will have Alexandra at our booth and doing a seminar. So you'll be able to meet her in person. We're very excited to have that and to be able to meet you and have you speaking with our clients face to face. So that's going to be wonderful.
I'm looking forward to be there with you guys. So I look forward to meeting you finally in person.
Yes, yes. All right. Well, thank you so much, everyone.
Hugs from Italy, and see you soon. Bye-bye.
Bye-bye.